here at 312-663-0338. Looks like we have a caller. Go ahead, caller.
Good evening, ladies. Do you guys have an age requirement by any chance?
Age requirement? No. No, we don't have an age requirement. Well, thank you, caller. So, I want to get more into the House Bill 2354. Would you like to break it down a little bit more for people who don't know exactly what that is? Because I don't want to just keep throwing it out there and they're like, what is,
I'll give you just a very simple overview. The bill would do three things. One, it would make sure that the government can't interfere with the woman's right to parent or have a pregnancy to term, or to terminate her pregnancy, or to accept or refuse contraception. Also, this bill would provide comprehensive sexual health education in schools in Illinois, and would provide medically accurate and age-appropriate information. And this would be information that is based in abstinence, meaning that abstinence will be promoted as the 100% effective way for pregnancy prevention and from getting STDs or STIs or HIV or AIDS, but also talking about the full range of options that happen when you engage in sexual behavior, and how to protect yourselves and how to access the resources and services concerning your reproductive health. And it would address things as a lifelong journey, because your sexuality is a lifelong journey, and it isn't something that just happens in high school in a sex ed class.
Right.
Also, it would make sure that the government funded programs like Medicaid provided services to women like family planning, pap smears, prenatal care. And so what this bill would do is strengthen the laws in Illinois to ensure that women have access to a continuum of choices, and that they and their medical professional or provider can make that decision together, and that she can be in charge of her reproductive health and not have someone tell her how to govern her body.
Right. I think that's very important, because I don't even remember when I was in high school having a comprehensive health education course. It was like, what is that?
Yeah.
It wasn't really informative, and it was only for a semester I had the course, and I don't think you could possibly cover everything in that amount of time. So this bill, once again, is very important, and just support it. Call your legislators, write letters. You can call in to get information. You can also contact the Chicago Abortion Fund if you have any questions after the show. And I'm going to flash that one more time.
And if you,
And so,
and if you'd like to learn more information, or learn if your legislator is a co-sponsor of this legislation, you can visit IllinoisReproductiveHealth.org and find out ways of how to get involved, and to contact your legislators directly.
I think we have a caller. Go ahead, caller.
How you doing? My name is Dietrich, and my question to you all, I like your show and I like your view, but my question to you is, do you think or believe that this program, as far as the fund itself for what it's promoting, do you think this is misleading the youth, the poor, impoverished black women in these communities to go on with unsafe sex?
No, I don't actually at all, because if you want to come to terms with the pregnancy, if you want to terminate a pregnancy, we support you either way. We're not saying this is the only way to go. And I don't think it's misleading, because if you can decide that you want to have sex or engage in sexual activities, I think that you pretty much can decide when you end up pregnant what to do with that pregnancy. I mean, I know for myself that I have a daughter, and when I had my daughter, I wanted to have her. I wanted to have her at the time that I did. I wanted to come to terms with that pregnancy. And then when I got pregnant again, I knew what I wanted to do. I knew I wanted to terminate the pregnancy. I knew that that was what I wanted to do. We have another caller. Go ahead, caller.
Hi, yes. I'm an educator. I'm a teacher for Chicago Public Schools, and I'd just like to congratulate you all on having this on the air. I believe that it's so important that we do have pro-choice. I think that, everybody can't have a child. I had the abortion, and I also have 2 beautiful children. But at the time when I had my abortion, to me, I felt as though it was necessary. Having an abortion allowed me to go to college and get a degree. And so now I do have 2 children, and I am a young parent still, but I was able to do that because at the time I made this decision to not have this child. And so I really do want to thank you all for having this on TV and so other people can see this, because it is important. And it's not just you saying, oh, well, I'm going to terminate pregnancy. No, this is about your life, your decision.
Oh, well, we thank you so much for calling in and supporting us, and we understand completely. And I just want to stress one more time that that is exactly the reason why we need to support House Bill 2354.
The Reproductive Health and Access Act. You can learn more at IllinoisReproductiveHealth.org and urge your legislators to sign on and vote for this important legislation that will provide women a continuum of choices throughout their reproductive lives. Thank you for having me.
Oh, thank you for being here. And we just want to say thank you to all our viewers and our callers, and have a good night.